Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
ENT2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency. We're servicing Miami, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. And today I am delighted to introduce everybody to Dr. David Kasle. You can reach him directly. He's an ENT, and you can reach him at online at www.entfortlauderdale.com, and the Plantation office is the phone number is 954-476-0400, and the Coral Springs number is 954-796-0400. Thank you so much for joining us today, Dr. Kasle.
Well, thanks for having me. Good to be here.
We appreciate that. I think this is the first time I interviewing an ENT.
Oh,
so
well, we're a lot of fun.
I am excited to pick your brain and ask you some questions. I usually like to start off with maybe some background. If you want to share with our viewers and listeners a little bit more about where'd you go to school and what made you want to become an ENT.
Sure. I went to school. I went to medical school at Albert Einstein College of Medicine, which is in the Bronx.
Oh, yes. I'm from New York.
Yeah.
I know the area.
Okay,
I'm
sure.
from Queens.
So my wife and I lived in the Bronx for a number of years, and
Okay.
then after we finished, we moved to New Haven, and I did my residency at Yale in ENT.
Very
and
nice.
And then after residency, we came straight down here to Florida, where we have quite a bit of family, and I've always loved being.
Okay. I was going to ask, are you from here or?
I'm actually originally from Flint, Michigan.
Oh, okay.
Yes, Flint
Nice.
is famous for a number of things.
Yes.
And so I grew up there and then kind of moved around a little bit and ultimately mostly ended up in the Northeast. I did my schooling up in the Northeast, up before medical school, and then continued up there.
Well, we're lucky to have you here.
Well, thank you.
We appreciate that.
Yeah.
Yeah, so I'm just curious. I always like to ask people that I interview, can you remember that time where you're like, I want to be a doctor? Like, was there any pivotal or moment
Like epiphany
in time?
moment?
Epiphany moment?
Yeah. The answer is I don't think, not to be a doctor, I don't think. To be an ENT, I almost feel like I hone in on a single moment. To be I came from a medicine family.
Okay.
My father's an ophthalmologist, and you
nice.
grow up with a doctor in the family, and you kind of see all the benefits of having that, what you're able to offer and provide for your family, but also community. There was always someone coming over, someone who needed a little bit of help. They're coming over in a time of distress, right?
Yes.
Folks are unhealthy, there's something that's going on, and you're a little bit scared, and it's nice to have that person in your life that can, put you at ease to a degree and make sure that everything's okay. And so I saw that my dad was able to do that, and I kind of think I always wanted to be able to do that for my community. And then once you go to medical school, you have to figure out medicine and surgery, and ENT offered both, really. And I think that that moment for becoming an ENT, I was on my surgical rotation, which is during your third year. You try out everything.
Okay.
You go, you dip your feet into medicine, you dip your feet into cardiology and gastroenterology. And I was on a general surgery rotation, and they called, the chief resident came in the room and said, hey, could you come help with a case? I said, sure. So we go downstairs, and as a medical student, you're just retracting. So you get a great view, and you're just holding instruments to give the surgeon space to operate. And he was doing what's called a thyroidectomy, which is where you take out the thyroid. Oh, wow. And it can happen for a number of reasons, sometimes cancer, sometimes other things. And I just remember, you make an incision, it's right at the front of the neck, you're going through these really delicate structures, and when you take out the thyroid, you have to find this teeny tiny wispy nerve. And so I just remember the surgeon kind of slowly dissecting down onto this nerve, layer by layer, and you don't want to traumatize it. You don't want to, you know, it helps with speech and it helps with breathing. And I was just like, this is absolutely amazing. And so it was an ENT who was doing it. And and that was kind of the start of the path. And then, you know, then you find out more about the field.
I love hearing these stories because it really gives us a glimpse into your life and what you experienced and the humanness of, you know, your experience. So that's really nice.
Yeah.
Really, really nice. Yeah. So at your practice, curious to know, what are the age range of patients that you treat?
So our practice is mostly adults. We see some kids. We see 16 years old is usually when we start to say that's in our wheelhouse. I think most ENTs, when we train, we see the whole slew from, you know, newborn all the way till not newborn. And then, but when you get into practice, you kind of have to hone your practice a little bit. So we don't see pediatrics. We see young adults and adults, and we see everything. We're a general ENT practice, myself and my partners. Anything can range from, you know, hearing loss to head and neck cancer or sinuses and allergies. And so you see really a broad range of things in ENT, and we're fortunate to have a practice that sees quite a few of everything. So it keeps your day diverse and your patient population diverse, and lets you help quite a diverse group of people.
It sounds like it, and because there's so many intricacies and just different ailments that we could have, so it sounds like you have this whole big
we get the
variety.
neck kind of up, maybe not the brain.
True. So when I go, or when somebody goes to their primary care physician, what are some of the reasons why they might say, you know what, you need to see an ENT? Well,
that's a great question.
Yeah.
It's a broad, great question. There are a lot of reasons to see an ENT. A lot of times, you know, you go to your primary doctor and you might be dealing with something that you don't find is a problem, but then your primary is like, you know, you've been here quite a bit for this nasal congestion, or you're not breathing well, you got a lot of drainage, or a number of sinus infections. And it gets to the point where you've given them one round of antibiotic after another. And you've tried all these sprays and you've done all these tricks, and it's like, I think we need to kind of take the next step. And that's an example of, hey, let's get you to an ENT. And, you know, in our field, we have maybe more tools to deal with some of those specific issues. You know, we'll start to say, you know, we're going to allergy test you. You know, most ENTs are doing allergy testing or getting CTs of the sinuses to make sure there's no underlying problem. And sometimes there's not. And sometimes it's just like, listen, you've had nasal congestion, you can't breathe through your nose for a long time, you've tried all these sprays, and now we can start talking about procedures or surgeries that maybe could significantly improve your quality of life. Those are the nice, great cases because we're really helping quality of life. And folks, you know, that maybe everything's okay, you're just going to make it maybe better. Of course, sometimes you have folks come in that, you know, you've got a neck mass and there's something concerning and you're worried about an underlying, you know, malignancy or pathology that's more dangerous, and you got to get it to a specialist, which is what we do as well. So there are any number of reasons why we might see somebody from a primary office.
So going back to the sinuses, because it's so commonplace, are people born this way, or is this developed over time? I know I'm asking you questions.
No, this is a tough question to answer.
What came first, the chicken or the egg, right?
Exactly. I think that, you know, we're humans, and like all of medicine, there's not always a perfect answer. There was a long time when they were talking about, when I say they, I don't even know who I mean. You know, folks were talking about, why is it that people have constant congestion or constant sinus infection? And this is one of the most common things, especially down here in Florida, right?
That's what I mean. I know so many people with that.
So you say, well, maybe it's allergies. There was a period maybe 150 years ago where we thought, you know what, everyone's that's suffering's got like some sort of fungus hidden somewhere, or constant bacteria that antibiotics just are not getting rid of. And now I think that specifically with sinuses, the thought process is that there's something going on with your immune system. You know, maybe one part of your immune system is a little more aggressive than it should be, and so this is just part of who you are, and every person's made up a little different.
Sure. Of
And
course.
so some people are just a little bit more reactive. Same with allergies, right?
True.
I happen to be allergic to cats, so when I'm exposed to a cat, I just have a different response than some other people who aren't, and it's just the way my body is. So sometimes we don't know. Sometimes it's probably an innate or an adaptive immune response that's not quite perfect, and we work pretty hard to try and find a way to make it so that you're safe, but also you feel good and you feel better and you can breathe okay, and you don't sneeze as much or whatever it is.
So do you think it's necessary? I feel like so many people have allergies. Do you think it's necessary people can just go to your office and do an allergy test?
I think necessary is, I don't know if it's, I think that it comes down to the person's, how their quality of life is.
Okay.
Everyone is a little bit different in what they, I have patients who come in and they say, my ear hurts a little bit. We'll look in, maybe there's some wax, maybe there's a slight infection, we take care of it, and off the cuff you say something like, oh, you have any allergies or any congestion, just to make sure you don't miss anything. They're like, well, yeah, I can't breathe through my nose.
Oh.
And you say,
okay.
Well, does that bother you? And I say, not really. And you're like, okay. And then you have other folks who come in, and this is really something that is a fundamental part of them. They can't sleep because they're so congested at night. And so for people that are bothered and people that it's bothering them, yeah, absolutely. Come in. We'll make sure it's allergies. We'll make sure it's not something else, and try and treat that. And I think that many people are happy to get allergy tested. And I had an interesting thing happen to me maybe 3-4 months ago. A young woman came in, and she was just struggling to sleep every night with nasal congestion, and she really didn't have any other allergy symptoms.
Okay.
And we had tried all the sprays like we talked about, the Flonase and all those other things.
Yeah.
And it just really wasn't working. And we finally got an allergy test, and she was completely negative. But we did a food test, and she came back positive to almonds.
Interesting.
And I'm like, all you are is positive to almonds. And she says, well, I eat almonds every night before I go to sleep. And I'm like, well, why don't we stop that? And she did, and she felt great.
You see?
Yeah,
It's
and
so interesting.
I don't know that you don't want to overdo it. You don't want to get a test on everybody for the sake of getting it. But I think that it's just stories beyond stories of how some things come in and you don't even realize it.
It's so amazing. How about people who are suffering from sleep apnea?
Yes, this
There's
is a
lot.
big field.
This is a big field,
This is
right?
a big
Do you see a
field.
lot of people
Sure.
suffering? Okay.
Sleep apnea is one of those broad fields that a number of different physicians get involved.
Okay.
You have pulmonologists, you have ENTs. I mean, there are a slew of them. I think ENT's role in sleep apnea has a lot to do with the procedures or surgeries that we can offer patients who have it. Used to be you had sleep apnea, you get a sleep study, and it would say, it's dangerous to the long-term heart to have sleep apnea, so wear the CPAP machine.
Right.
That's a tough thing to do. It's tough to sleep with the machine. It's
I've
tough for
heard.
the person, tough for the partner.
Yeah.
And nowadays there are, there's a procedure that's come out over the past, I don't know how many years, called Inspire, where, well, it's not Inspire, it's a technology that you dissect down into the neck to find a nerve which protrudes the tongue while you sleep and breathe in.
Oh, wow.
So most people sleep apnea happens because of collapse of the tongue. So now you program this, you sync up the respiration and this device to which is implanted in the chest to push out the tongue when you sleep so it doesn't collapse, so you don't have the apnea.
So you activate that at night?
Yep,
or?
you go to sleep.
Oh my
So
God, this is like
you
so
fall asleep.
amazing.
And I mean, this is
technology.
just one of the many options.
I'm just so amazed.
And I think there are ENTs that this is one of the bigger, ways that they can help with sleep apnea, that we do this surgery to help with sleep. So, that's one of the things about ENT in general. And I think that I was surprised by, which is kind of quite how broad it is. There's a lot of stuff that, especially when you go in. I saw the thyroidectomy to start, right?
Right.
And the next thing you know, you're doing like this case to push the tongue out while the patient sleeps. You don't always quite grasp quite how broad a field is when you first start.
That's so
delving into
true,
it.
because normally other doctors, it's like this niche thing, and they're whatever. There's
Yeah.
cardiology or this, that, but yours has this whole array.
I think that draws a lot of people into ENT. I think
That's
that you can be just medicine, you can do just surgery, you can do a combination of it. You can be one of these big head and neck surgeons that are, taking out cancers and reconstructing, malignant areas in the head and neck, or you can you know, keep it simple and stay in the office and treat folks, you know, there. And it's nice to have that, all those opportunities.
Right. Actually, we have a quick commercial break. We'll be right back, everybody. Stay tuned.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, everybody, to You and Your Doctor. We are having a delightful conversation with Dr. David Kasle, who's an ENT, and you can find him on the web at www.entfortlauderdale.com. Plantation office is 954-476-0400. Coral Springs as well, 954-796-0400. Dr. Kasle, I'm enjoying this conversation because I'm really learning. There's so many reasons why a person would go to an ENT, and there's I think the best thing is like to deal with a specialist, because you'll know what to do. And it seems that you also have colleagues that you work with in your office, so
Sure.
you have a broad spectrum of people there, so people can see you at the office and get all the help they need. And I know we were discussing prior to this, actually we were going to talk about the minimally invasive devices that you have, because we were talking about why would people come to your office. So
Right.
what are some of the reasons, some of the devices or minimally invasive things that you can
procedures.
do?
Yeah, there are a number of them in ENT. It's one of the reasons why I think ENT can be fun. A lot of surgical subspecialties have this, and I think that minimally invasive things it's kind of a buzzword.
Yeah.
People hear it, they like the idea
Yeah,
of it.
it's
You're
like
not,
you light up.
yeah,
Minimally
you light up.
invasive, I'm in.
This. Yeah, exactly. And they're all over the place. In office, procedures in general are popular because of that. Folks don't want to undergo anesthesia. They want to see what they can do to get better in the office. The most famous ENT one, for example, is balloon dilations of the sinuses. People know sinus surgery, and you have to open up the sinuses to clear them out. We talked, why people have that, but either way, you want to get in there, open it up, let people irrigate and get back to a healthy kind of nasal and sinus cavity. And so the first ones that probably came out, or at least that I can think of, are balloons. Get in there, instead of surgically opening it, dilate a balloon and recreate a natural outflow. And that was one of the big ones that we had for a long time. And now they're all over the place. People are doing injections into vocal cords in the office.
What is that for?
So a lot of people are hoarse for some reason or
yeah.
another. We talked about thyroid surgery.
Yes.
Let's say the nerve had to be sacrificed or something happened, and now the vocal cord is not quite where it should be, and
see.
it needs to be moved over to give people quality of life and quality of voice. So you can literally inject some material to push it a little bit to give a stronger voice.
Interesting.
We talked about nasal congestion. There's now these radio frequency devices that can open up the nasal cavity so that you come in, you numb up the nose for 15 minutes, and then you're getting this procedure to shrink down the tissue to create a more open airway to breathe better.
Wow.
That is a very popular, newer one that's been used over the past 20 years, maybe.
I love that. So it's radio frequency
Yeah.
treatment. Is it multiple treatments, or you have to?
The answer is no.
Okay.
It's not meant to be. I mean, you have it sometimes where patients love it, and then it kind of fades over many years, and
Okay.
you'll see it again. But in general, these things are really meant to be done, a
Wow.
one-time thing. There's
impressive.
probably one of the most common complaints we get is drainage, chronic rhinitis, where you always have a tissue in the hand,
Yeah,
and
my
you always
brother
have to
has that.
yeah. And it's tough, and you try, like we talked about, you try all the medicines and nothing's
Yeah.
working. So now the primary will send to the ENT, say, well, let's see what they, and you
Right.
make sure there's nothing else going on. And the first thing I think that came out was what's called cryoablation. You freeze this nerve in the back of the nose to prevent the drainage. And it worked really well. And now they have other ways of kind of ablating that nerve so that it doesn't create as much drainage in the nose. The other really common thing we see is for ears, people have what's called eustachian tube dysfunction.
Okay.
This is where, you're on an airplane
Yeah.
and you feel like you need to pop your ear.
Yes. Of
So
course.
this is very common. What's also common is that you're not on an airplane, you're just living life and you still feel like you need to pop your ear. So you're always living with kind of that fullness and congestion.
Okay.
And again, you try all these medicines or whatever, and it's just nothing's happening. Sometimes it's allergies. We treat the allergies, still not working. And so now you can go in through the nose and literally dilate open the natural tube that's supposed to pop your ear. And it allows you to have that, aerated middle ear and feel that kind of relief that you would get, say, after you, popped your ear after a flight.
Oh wow. That's
So I mean, there
amazing.
are a lot of things that we do in the office, and my weeks are probably one day of surgery, a few days, the other 4 days in the office, mixed with seeing patients and doing those procedures because people really want them and they help.
Your face lights up when you talk about this.
Oh.
It shows me that you're so enthusiastic to help your patients. That's my impression.
It's funny. It's the minute you say that, the one thing that you think of is like, it's hard to get in medicine to get almost instant gratification.
Yeah.
And none of these are instant gratifications. Maybe when we take out a wax from a patient's ear and immediately they can hear again is one of them. But in general, these people like the sort of things that can limit risk but offer a significant improvement in their quality of life. And I think that that's what it's what all medicine's trying to do. And a lot of ENT gets to do that. It's a little bit of a privilege to have that type of medicine.
Absolutely.
Yeah.
You mentioned something about earwax. Now I'm remembering I've had this question in my mind. Is it necessary for someone who's never officially had earwax removed? Is that a necessary thing to do? Like, I've never been to a doctor to do that.
Everyone should come in.
I'm just so curious.
It's funny. I actually don't think so.
Okay.
I've never had my earwax removed.
Okay.
And we all produce earwax. Earwax is healthy. It's good to
Okay.
have. Creates a acidic, healthy environment for the ear. A lot of times, and this is why, doctors will say never use Q-tips. A lot of times
I do, though.
Yeah, that's fine.
Okay, good.
Keep doing what you're doing.
Okay, good.
It's good. Everything's good. If you happen to create a little more wax, and that can happen as we get a little bit older or for whatever reason,
Right.
and you're using a Q-tip, you're pushing it in, and all of a sudden you literally create a barrier.
Oh, I
And now
see.
you can't hear, and it's blocking, sound waves from getting to the eardrum.
Right.
We got to go get it.
Of course.
A lot of physicians are capable of doing it. I think ENTs are probably the most comfortable because this is our anatomy.
Yeah.
And so, but yeah, I would say the answer to that is if it's never bothered you, never had a problem, just stay away from the doctor. It's
Okay.
just probably good advice in general.
We actually have a minute and a half left. If
Okay.
you can believe this time has flown by.
It's been a good time.
It's been an amazing time. I've learned so much. Was there any last call to action or anything you want to share with our audience before we leave in this last minute?
Look, I'm an ENT. I'm biased. I think ENT is a wonderful field, and I think it's a field where there are a lot of things that we can do to improve patients' quality of life, to help patients that are suffering. And I think that if for whatever reason you're feeling, maybe there's a step that you want to take or you need
Yes.
to take. Fortunately, there's a lot of us. Come find us. We'll help as much as we can, and I think that we offer probably things that
Yes.
that can really improve quality of life.
Well, we want to send them to you. Your
Okay.
number is 954-476-0400 in Plantation, Coral Springs 954-796-0400. Please give Dr. Kasle a call. Thank you so much, everybody, and have a great evening. We'll see you next week. Thank you.
Thank
It's
you.
been a pleasure.